My name is Aditi Agarwal. I am 18 years old and I'm a medical aspirant in India. I was a part of the Lumiere Fall Cohort 2021, and my research topic was the progress of active and passive immunotherapy in the treatment of triple negative breast cancer. I wrote this paper under the mentorship of Valentina Kostevic. Next. Breast cancer is a type of cancer that starts in the breast and accounts for 23% of the total cancer cases on an average per year. Triple negative breast cancer, or TNBC, is a special type of breast cancer which accounts for 10 to 20% of all the invasive breast cancers or the cancers that have spread into the surrounding tissue. TNBC is especially difficult to treat because it lacks these various receptors like the ER, PR, and HER2, estrogen receptor, progesterone receptor, and the human epidermal growth factor receptor 2. Chemotherapy is at present the major treatment option available, but it also has its limitations. Thus, there is an ongoing research on potential immunotherapies, which are again of two types, passive and active. Passive immunotherapy is the passive acceptance of antibodies, cytokines, or transformed immune cells by an organism that can directly attack the tumor. Monoclonal antibodies are antibodies that bind to receptors or ligands on the surface of tumor cells or immune cells and block the corresponding signaling pathways, exhibiting the anti-tumor effects. For example, in the figure, PD-1, that is programmed death-1 receptor on the tumor cell, binds with PD-L1 or the programmed death ligand 1 receptor on the T cell and suppresses the immune activity. Now, if we inject an anti-PD-1 or PD-L1 antibody into the patient, we can stimulate the anti-tumor activity. Now, what are oncolytic viruses? These are synthetic viruses without pathogenic factors, that is, they spare the healthy cells and they still have the ability to kill the tumor cells. In adoptive cell therapy, we basically take T cells, a type of immune cells, and we grow them in large number in the laboratory, make them immunocompetent, and give them back to the patient to help the immune system fight the cancer. One example of this therapy is the CAR, or chimeric antigen receptor T cell therapy. Now, active immunotherapies involve the elimination of cancer cells by stimulating the body's own immune response. An example of this therapy is tumor vaccine. Now, this is especially an interesting fact because vaccines are usually given as preventative measures, but here tumor vaccines can also be used to treat existing cancer. And such vaccines are known as therapeutic cancer vaccines. Advantage of tumor vaccination is that it is highly specific and it has very few adverse events. Then there are various targeted therapies under clinical investigation, which target specific molecular pathways to prevent the tumor growth. For example, vascular endothelial growth factor inhibitors, VEGF inhibitors, PARP inhibitors, etc. Next slide, please. The method used to revise this paper was literature review, wherein the past literature on the topic was extensively studied and discussed. Approximately 20 to 25 academic papers were analyzed and discussed to formulate this paper. Next. Now, there are multiple systemic factors which contribute to the success of immunotherapy. For example, a patient's gut microbiome, their diet, genetics, etc. We also need to identify biomarkers which will help us carve out a subgroup of patients who only need immunotherapy and might avoid the toxicity of chemotherapy. Then neoantigens are also a hot topic because these are special type of antigens produced by oncogenesis and they are ideal targets to recognize the cancer cells. Neoantigens are again divided into two categories, tumor-associated antigens and tumor-specific antigens. Tumor-specific antigens are usually easier to target because they are expressed in the cancer cells only and not in the normal cells, whereas the tumor-associated antigens are rarely expressed in the normal cells, but they still have a chance of being expressed there. For the tumor neoantigen prediction algorithm, there are many factors to be considered. For example, HLA typing or human leukocyte antigen typing, mutation analysis, peptide processing, etc. By taking advantage of the immune activity of neoantigens, specific drugs can be designed. Advancements in the study of neoantigens will lead the path in the development of personalized treatment options for patients. The major challenges in the development of these neoantigens include lack of effective screening methods, long development cycle of the neoantigen, the preparation and delivery of neoantigens, tumor heterogeneity, and the high cost of treatment.